Guys, I really want to know, why do some people or some relative leave their loved one in the hospital without anybody to stay with them? On today's story, we were unusually busy because the government hospitals, the nurses and doctors are on warning strike. So it's usually a kind of advantage to the private hospitals because they will have more influx of patients. I had an elderly woman on admission whose relative do not want to stay with. The first day someone stayed, the second day they just left her all by herself. They were claiming they left around 11 p.m. The woman was there all alone. When we resumed duty, the night duty nurse handed over to us. We have to call them. Even at that 8:30, they were yet to come. So we have to call them. They came. Their excuse was that nobody to stay with the mother, that they were all busy, both the ladies, the guys, everybody was busy. We were like, can't you find someone to stay with her? Even if you need to pay someone to stay with her. The admission will not last forever, it's just for a few days, and she's also responding to treatment. I understand sometimes it might not be what you planned, it might not be easy, but you can at least try just few days and the mother is fine. The mother will be fine and you go home. Though we tried talking to them, but they were still adamant on getting someone to stay with them. Guys, I really want to know, why do some people or some relative leave their loved one in the hospital without anybody to stay with them? This is not the first time. We do experience that often and often. Both the ones that can take care of themselves and the ones that cannot take care of themselves. Most times we have to threaten them that will discharge the relative with or without feeling better. That's when they will cooperate. Why do people do that? Why would you allow your loved one to stay in the hospital without anybody to be there with them, especially the critical ones? This is one of the things we face in private hospital. Honestly, it's not really fair and it's making our work more tedious.